Hi, this is Dr. Lewicki, and I'm talking to you about the exemplar of cancer. And this presentation is divided into three parts. So in this part of the presentation, we're going to be talking about the pathoetiology, clinical manifestations, and such. The second presentation talks about treatments and the options along with treatments. I think it might include diagnostics as well. And then the third presentation is about the nursing management. So cancer is a group of diseases that are characterized by uncontrolled and unregulated growth of cells. And refer back to the cellular regulation PowerPoint for the typical cell cycle. It occurs in people in all ages, but it occurs most often in those over age 55. The incidence of many cancers have declined in the last several years because we have a lot of preventative efforts and screening tools. Cancers such as kidneys, thyroid, pancreas, liver, uterus, skin melanoma, multiple myeloma, and non-Hodgkin's lymphomas has been increasing, however. And the gender differences in incidence and in death rates for specific cancers are listed for you in a table 15.1 in your textbook. So cancer is defective cell proliferation or growth. And the defective cell differentiation, there's a defective cell differentiation, and there are three stages of cancer. The initiation stage is the first stage, and that's the mutation of cells' genetic structure. Any change in usual DNA sequencing. The promotion stage is an important distinction between initiation and promotion, is that the activity of promoters is irreversible. Sorry, is reversible. Let me say that again because I messed that sentence up. An important distinction between initiation and promotion is that the activity of promoters is reversible. This is a key concept in cancer prevention. About 1/3 of cancer-related deaths in the United States are related to tobacco use, unhealthy diet, physical inactivity, and obesity. Some carcinogens are capable of both initiating and promoting the development of cancer. These carcinogens are termed complete carcinogens. Cigarette smoke is an example of a complete carcinogen capable of initiating and promoting cancers. There also may be a latent period during the promotion stage, and that can range from anywhere from 1 to 40 years. The length of the latent period associated with mitotic rate of tissue of origin and environmental factors. For disease to be clinically evident, tumor must reach a critical mass that can be detected. So sometimes, like on a chest x-ray, for example, it's too small to detect until that cell grows or the cancer grows large enough to be seen on x-ray. Progression is the final stage in the natural history of cancer. It's characterized by increased growth rate of the tumor, invasiveness, and metastasis. Metastasis is the spread of the cancer to a distant site. Certain cancers seem to have an affinity for a particular tissue or organ as a site of metastasis. For example, colon cancer often will spread to the liver. Other cancers are unpredictable in their pattern of metastasis, like melanomas. The metastasis process, detached cells can invade lymph nodes and vascular vessels to travel to distant sites. Most mobile tumor cells do not survive. Surviving tumor cells must create an environment conducive to growth and development, and once free from the primary tumor, metastatic tumor cells frequently travel to distant organ sites via hematogenesis or lymphatic routes. These two routes of metastasis are interconnected, Thus, it is theorized that tumor cells metastasize via both routes. Um, there's a sentinel lymph node. That's the first node confronted as tumor cells spread through the lymphatic system. Biopsy can help determine the extent of cancer. And skip metastasis is when tumor cells travel to distant nodes in the lymphatic system. Tumor cells may be trapped in the first lymph node confronted and likely spread from a tumor or sentinel lymph node. A biopsy can be done of the sentinel node to help determine the extent of the cancer, and the procedure is less extensive, requiring the removal of fewer lymph nodes. Tumor cells may bypass regional lymph nodes and travel to more distant lymph nodes, a phenomenon termed skip metastasis. This phenomenon is exhibited in malignancies such as esophageal cancers. So cancer involves the malfunction of genes that control differentiation and proliferation. Proto-oncogenes are normal cell genes that regulate normal cell processes to keep them in their mature functioning state. Genetic locks keep cells functioning normally. When this lock is unlocked, as may occur through exposure to carcinogens or oncogenic viruses, genetic alterations and mutations occur. The abilities and properties that the cell had in fetal development are again expressed. When proto-oncogenes are mutated, they can begin to function as oncogenes, or tumor-inducing. Oncogenes can change a normal cell to a malignant one. This cell regains a fetal appearance and function. For example, some cancer cells produce new proteins, such as those characteristic of the embryonic and fetal period of life. These proteins located in the cell membranes include carcinoembryonic antigen, or CEA, and the alpha fetoprotein. Tumor suppressor genes, such as the BRCA1 and BRCA2. Another tumor suppressing gene is the APC gene. Alterations in this gene increase a person's risk for familial adenopatous polyposis, which is a precursor for colorectal cancer. Mutations in the p53 tumor suppressor gene have been found in many cancers, including the bladder, breast, colorectal, esophageal, liver, lung, and ovarian cancers. Causative agents for cancer are carcinogens. Carcinogens are cancer-causing agents capable of producing cell alterations. Many are detoxified by protective enzymes and are harmlessly excreted. Failure of protective mechanism allows them to enter the cell's nucleus and the DNA. And they can be chemical, radiation, viral. Chemicals were identified as cancer-causing agents in the latter part of the 18th century, when Percival Pott noted that chimney sweeps had a higher incidence of cancer of the scrotum associated with exposure to soot residues in chimneys. Persons exposed to certain chemicals over a period of time have a greater incidence of certain cancers than others. The long latency period from the time of exposure to the development of cancer makes it difficult to identify all cancer-causing chemicals. Many chemicals have been identified over the years, such as benzene, arsenic, formaldehyde, radiation. Radiation can cause cancer in almost any human tissue. Damage occurs to the DNA. Ultraviolet radiation is associated with melanoma and squamous and basal cell carcinoma. Sunlight is main source of the UV exposure, and certain malignancies have been correlated with radiation as a carcinogenic agent. Leukemia, lymphoma, thyroid cancer, and other cancers increase in incidence in the general population of Hiroshima after the atomic bomb explosion. Higher incidence of bone cancer occurs in people exposed to radiation in certain occupations, such as radiologists, radiation chemists, and uranium miners. And so you'll see in the hospital that radiology techs and radiologists and people working in the X-ray department wear a meter on their badge to detect how much radiation that they've been exposed to, and that they have to go out of the department if they meet their lifetime maximum. Skin cancer is the most common type of cancer among whites in the United States, and of great concern is the increase in the incidence of melanoma, although it's probably multifactorial. UV radiation secondary to sunlight exposure is linked to the development of melanoma, and that's the UVA and UVB rays. And that's also true of the UV radiation of tanning beds. Viral carcinogens is what we're going to talk about now, and certain DNA and RNA viruses termed oncogenic can transform the cells they infect and induce malignant transformation. Viruses have been identified as causative agents of cancer in animals and humans. And some of these are Burkitt's lymphoma is associated with Epstein-Barr virus. People with AIDS have a high incidence of a Kaposi sarcoma. Other viruses that have been linked to the development of cancer include the hepatitis B virus, which is associated with hepatocellular carcinoma, and the HPV virus, which is associated with cervical, anal, head and neck cancers that are caused by a squamous cell carcinoma. To produce metastasis, tumor cells must detach from the primary tumor and enter the circulation. They have to survive in the circulation to arrive in the capillary bed, adhere to capillary basement membrane, gain entrance into the organ parenchyma, and the word parenchyma, that's the tissue itself of whatever the organ tissue. Respond to growth factors, proliferate and induce angiogenesis, and evade the host defenses. And this is just a picture demonstrating that. So the risk factors for cancer are both non-modifiable and modifiable. About 1/3 of cancer-related deaths are related to tobacco use, which we've already talked about, unhealthy diet, physical inactivity, and obesity. Some carcinogens are capable of both initiating and promoting the development of cancer. Cigarette smoke, we've talked about that already. And we've talked, so other factors, obesity, smoking, alcohol use, dietary fat, exposure to ultraviolet light, exposure to chemicals. And that includes nitrates, like gastric cancer is associated with nitrates, smoked meats and things like that. Poverty, stress, recreational drug use, and diet. Non-modifiable age, gender, and heredity. And we've talked about that. The older the person, cancer is generally a disease of the older population. And each cancer, the gender differences depend on the type of cancer. In general, tumors can be classified as benign or malignant, and benign neoplasms are well differentiated, and malignant neoplasms range from well differentiated to undifferentiated. And the tumor has had the ability of malignant tumor cells to invade and metastasize, and that's one of the major differences between benign and malignant neoplasms. And there's more information on that on table 15.3 in your textbook. The plan of care begins when cancer is suspected, and diagnosis may follow abnormal screening test results or when symptoms appear. And diagnostic assessment is going to include the health history, history of the present illness, any risk factors that are identified, physical exam, and specific diagnostic studies related to the type of cancer suspected. So whether it's a chest x-ray, a CT scan, a PET scan, or lab work, depends on the type of cancer. There are different things. The radiology studies or radiographic studies include nuclear, bone, and liver scans, ultrasound, CT, MRIs, and PET scans. Labs, the carcinoembryonic antigen, the CEA, and the alpha fetoprotein. I talked about those earlier in this presentation. The other CA125 or prostate-specific antigen, those are going to differentiate specific types of cancer. They'll do a CBC to detect any type of blood cancer, and they will do liver function tests as well. PET scan, this is just an image of a before and after treatment. PET scan is positron emission tomography, and this is before and after treatment. So scan A shows metastasis throughout the body, and then after treatment, whatever treatment it was, it shows the effect or how much less metastasis there is. More radioactive material accumulates in areas that have higher levels of activity. So the classifying the extent and spread of disease is termed staging. This classification system is based on the anatomic extent of disease rather than on cell appearance. And so you can see that the staging, the lower the number, the better the disease, the higher the number, the worse. I don't want to get into too much with this. So, but 0 is there's the presence of cancer, and 4 is that there's metastasis. And then there's the TNM classification system, and it's that system is the anatomic extent of disease. So again, T is the tumor sizes and invasiveness, N is has it spread to the lymph nodes, and M is has it metastasized. Pathological evaluation or biopsy of a tissue sample is the only definitive means to diagnose cancer. It can help determine if it's benign or malignant. They'll look at the anatomic tissue from the tumor, and that's the histology, and the degree of cell differentiation is the histological grade. They will do this in a couple of different ways. They can do either through surgery, they can take a piece of tissue and send what they call a frozen section, or they can do a needle aspiration biopsy as well. The most frequent sites of metastasis are the lung, the brain, the bone, the liver, and the adrenal glands. And this is from your textbook, figure 15.3. There are lifestyle habits to reduce your risk of getting cancer. Their practice recommended cancer screening, so pap smear, mammogram, colonoscopy, rectal or prostate exam, self-screening breast exam, self-breast exam, self-testicular exams. So practice recommended cancer screenings and self-exams. Know your 7 warning signs of cancer. And I believe this is on the next page too, but it's change in bowel or bladder habits, a sore throat that does not heal, unusual bleeding or discharge from any body orifice, thickening or a lump in the breast or elsewhere, indigestion or difficulty in swallowing, or difficulty in swallowing, obvious changes in a wart or mole, nagging cough or hoarseness. And seek medical care if cancer is suspected. And again, these are the 7 warning signs of cancer, and you'll notice that they spell the word caution. And I'm not going to read those to you, but I'll leave the slide here for a minute so that you can look at it. And that's the end of part 1, and part 2 we'll talk about treatments. Thank you.